to start this evening's program. We are honored to have the Bloomington International Association of Firefighters Local Union 49 to present the colors, who are representing all of our first responders who have done valiant community service throughout the entire COVID-19 pandemic. We extend our sincere gratitude to each and every one of them. Thank you. And now I would like to welcome Julie Emick, Executive Director of the McLean County Museum of History.
Thank you, Candace. Of course, today it wouldn't be sunny, but given the event we're commemorating right now, I think that's probably all for the best. I have this poem by Edward Hirsch called What the Last Evening Will Be Like. You're sitting at a small bay window in an empty cafe by the sea. It's nightfall, and the owner is locking up, though you're still hunched over the radiator, which is slowly losing warmth. You're walking down to the shore to watch the last blues fading on the waves. You've lived in small houses, tight spaces. The walls around you kept closing in, but the sea and the sky were also yours. No one else is around to drink with you from the watery fog, shadowy depths. You're alone with the whirling cosmos. Goodbye, love, far away, in a warm place. Night is endless here. Silence, infinite. Poetry is always my preferred language when there really is no language, and it is impossible to sufficiently describe the depth of grief and loss that so many of us have experienced. This afternoon, the McLean County Museum of History is proud to serve as a centerpiece for our community to come together and celebrate, commemorate, counter, or otherwise console one another in times of suffering. I turn this back to Candace.
Thank you, Julie. I would like to introduce poet, writer, actor Kathleen Kirk, who will read a poem she created especially for this occasion, using words that members of our community have submitted to the 12 Months in 6 Words project. And we'll be remembering 1 year of COVID-19.
These are our words. These are our words, words we uttered this hard, uncertain, terrible year. Our calling out to each other in unity from our separate places. Our bells on doorsteps. Our songs from windows. Cries in the night. This is our loneliness, our isolation. This is our grief, our numbness from loss, from stress, from suffering alone, unable to attend the bedside of our loved ones, dying alone. This is our bone-deep fatigue. This is our heartbreak, our chaos, our frustration, our uncertainty, our fear, our anger arising from our fear. We are crying behind our masks. We are smiling behind our masks. We are defiant, going without masks. Remember how we taped colorful hearts on our doors and windows? How we smiled and waved, said hello from sidewalk, street, or trail when finally we could walk out again in spring. This is our community. This is how we came together in our lonely time of need. This is our generosity, our ingenuity, our gratitude. We found our new priorities. We delivered food, masks, supplies, brought joy, theater, yard signs, birthday balloons. This is our resilience, our courage. This is our strength, our patience. This is how we came together in our lonely time of need. This is how we come together now in our shared, enduring hope.
Thank you, Kathleen, for such a beautiful and moving poem. Next, I would like to introduce Molly Ward, who is with the Interfaith Alliance and Carl Broman Medical Center.
Good evening. One of the purposes that memorials serve is to ensure that we learn from the wisdom of hindsight so that we don't have to repeat our experiences. Sadly, as we gather in this hybrid way on this almost but not yet spring evening, it's pretty apparent that the pandemic that has held us in its grip over the past year isn't entirely done with us yet. Even as we speak, there still are patients in our hospitals fighting for their lives. And it is likely that before another year passes, there will be more flags on this lawn representing not only residents of McLean County, but people from surrounding areas who have spent their last days and hours in local facilities. With that in mind, I share with you an adaptation of a prayer for a pandemic, a prayer that was written almost exactly a year ago, when we really didn't have the wisdom of hindsight to guide us. And precisely because we really don't know where we will be a year from now, let us hold fast to what will always bring and hold us together as a community. May we, who have been merely inconvenienced, remember those whose lives are at stake. May we who have no risk factors remember those most vulnerable. May we who have had the luxury of working from home remember those who still must choose between preserving their health or making their rent. May we who have had the flexibility to care for our children when their schools have closed remember those who have no options. May we who have had to cancel our trips remember those who have no safe place to go. May we who have lost our margin money in the tumult of the economic markets remember those who have no margin at all. May we who have been restless, quarantining at home, remember those who have no home. When fear grips our country and our community, let us choose love. At times when we cannot physically wrap our arms around each other, let us yet find ways to be the loving embrace of the holy to our neighbors. Amen.
Thank you, Molly. Next, I would like to introduce Bloomington native Kendall Miles, who will be singing God Bless America for us this evening.
God bless America, land that I love. Stand beside her and guide her through the night with the light from above, from the mountains to the prairies, to the oceans wide with foam. God bless America, my home, sweet home. God bless America, my home, sweet home. From the mountains to the prairies, to the oceans wide with foam. God bless America, my home, sweet home. God bless America, my home, sweet home. Thank you.
Thank you so much, Kendall. Our next speaker is Marianne Manco, Public Affairs Coordinator with the McLean County Health Department.
Anybody getting tired of wearing these? I know we are, but we need to be patient. Thank you for being here with us tonight. As we reflect back to 1 year and the emergence of this virus, a lot of residents turn to the McLean County Health Department for answers and guidance. And during this time, we too, along with the experts at the CDC and the World Health Organization, we were learning about this virus, and it was changing all the time, daily, sometimes even hourly. Every positive test, every person who was hospitalized, put on a ventilator, and especially every person who lost their lives to this horrible pandemic deeply affected us at the McLean County Health Department. But it also highly motivated us. And soon enough, all hands were on deck and still are. At first, the nation and McLean County focused heavily on testing. Remembering back to this time last year, we were still developing the tests. Can you believe that was a year ago? Doesn't that seem like a decade ago? We were still developing tests. It was very difficult to get tests. In fact, even in April and May, testing was difficult to come by. You had to be hospitalized or very ill. But soon, we did have more and new and better testing. When approached by the Illinois Department of Public Health about identifying a possible site ground for the drive-through testing site in McLean County, the county fairgrounds stepped up and a drive-through mass vaccination site at the Interstate Center was set up by IEMA, IDPH, and the National Guard. At first it was open 5 days a week. And again, it seems like a long time ago. Has anybody gone through the testing? Remember waiting in those long lines? The test results could take up to a week for you to get them back. Today, that site is open 7 days a week, 9 to 5. Test results are averaging 24 to 48 hours. They can be emailed right to your email or your phone. 14 daily shuttles are available from the nearby Walmart for those who do not have who need to use public transportation. And to date, over 250,000 COVID-19 tests have been conducted in McLean County. That improved testing then paved the way for contact tracing. This is an important tool that interrupted the spread of COVID-19 in our community, and it saved countless lives. What was once a secondary function of our communicable diseases department developed into a 50-person team who at the height were contacting hundreds of residents in isolation a day. By mid-November, we were seeing over 1,000 new cases of COVID a week, 1,000 new cases per week, with over 1,500 people in isolation every week, and the positivity rate at that time was 14%. Today, it's 2%. Next came the vaccine. Again, it's hard to believe that a year ago we were talking about how lucky we were going to be if we could see a vaccine by the summer of 2021. My, how far we have come, right? The first dose of COVID-19 vaccine was met with cheers when it arrived in McLean County in December. By January, over here at Grossinger Motors Arena, we had a mass vaccination site set up, and it was then used as a model by the Illinois National Guard, who then set up other mass vaccination sites across the state. This week, we announced that the Illinois National Guard has begun assisting the McLean County Health Department with mass vaccination at both Grossinger Motor Arena and with mobile sites across the county. The McLean County Health Department can now administer up to 23,000 vaccines per week. Now all we need is the vaccine. Keep our fingers crossed. To date, the McLean County Health Department has vaccinated about 60% of our Phase 1A and 1B population, and we anticipate opening vaccinations to that expanded 1B plus population very soon. All McLean County residents of long-term health care facilities have had access to at least one dose of the vaccine and are on schedule to be fully vaccinated by the end of this month. That's all through a federal partnership with CVS and Walgreens. Our weekly supply of vaccine is still lower than what we prefer to have right now, but it is expected to continue to increase. And with the approval of the new single-dose Johnson & Johnson vaccine, we now have 3 very effective vaccines that are available to help us in this fight. The McLean County Health Department is dedicated to vaccinating as many residents as possible, and we want to do it quickly, definitely want to do it safely, and we want to do it equitably. That's our goal. The McLean County Health Department will not rest until we conquer this pandemic, but we can't do it alone. So we've come a long way in the past year, but we must not allow ourselves to become relaxed about these precautions. And lately, we've been seeing a little bit of that, haven't we? I want you to look at these flags. 175 people just in our county who died, who gave their lives in this battle. And I'm going to ask you tonight to honor them by doing these 3 things. I was going to make you hold your hand up and bow, but I won't do that. Number 1, please learn as much as you can about this virus and about the vaccine. If you have questions about it, anything about the vaccine, by now you should be asking your doctor. And if you know anybody who has any questions, please make sure they're asking their doctor too. Lots of great information at the CDC website. We have it on our website as well. The McLean County Health Department has its own separate website. Please go to it, because right on the front page are some moving banners, and you can click on a Vaccine Facts Town Hall. Local doctors, many of them your doctors, are on there talking about this vaccine and talking about the science behind the vaccine. So we kindly encourage you to watch that. It's 90 minutes long, but just the first 20 minutes of it, you'll learn 75% of what you know, and you will be a walking encyclopedia about this vaccine. Number 2, consider taking on the role of vaccine influencer or ambassador. And I am actually granting you that title tonight. Be a vaccine influencer or a vaccine ambassador. When you have that family member out there who just isn't really sure they want to get that vaccine, let's practice how we're going to say it in a kind and loving way and say, Uncle Fred, I love you. But no, this vaccine does not have a microchip, and it's not going to change your DNA. And since you've already done your research, you'll know about that, and you'll be able to speak intelligently about it. If they're just a little weary and they're not really sure based on their health, encourage them to see their doctors. Have that conversation. You don't want another flag here representing somebody that you love and knowing that they had a fear about this vaccine and that at least you didn't try. So please do that. And number 3, I'm asking you to remain vigilant tonight. Test often. You don't have to be showing signs. Even if you showed up someplace or you were exposed in some way that had you thinking, I wonder if I just got exposed to COVID-19. You know what? Go get a test. The testing site is open at Interstate. It is not busy. You'll get the test results quickly. We're asking you to wear these, wear your mask. I know nobody wants them right now, but let's not throw the game in the 9th inning. We're very close and we're rounding a corner here. So let's encourage other people to do that. And of course, continue your social distancing. We all have our part to do, and if we do it 1 year from today, we can be here celebrating the lives that we saved as opposed to the lives that we lost. And that's our goal here at the McLean County Health Department. Thank you.
Thank you, Marianne. At this time, I would like to take a moment to recognize those we have lost to COVID-19 in our community. Here on the museum's lawn are white flags that represent each of the 175 community members who are no longer with us due to complications from the virus. But those individuals were so much more than a flag or a number. These people were our friends, our neighbors, our family members, our co-workers, our caregivers, strangers on the street. But all of them were essential to someone. All of us here tonight likely know someone who has had COVID. And sadly, many of us also know someone who lived in our community, our state, and our nation who did not recover. We have all struggled to find the means of such loss, and we seek a community of shared mourning, an affirmation that we are not alone in our grief. Let us together take a moment of silence to remember all of those we have lost, to remember the impact they had on us, on our community, and our world. Though they are gone, they will not be forgotten. Thank you. Finally, we have a group of students with BCAI Cultural Arts and Humanities who will perform to I Am Light by India Ari. much. Thank you to all of you who have joined us tonight, from wherever you may be. As we continue through this journey and navigate the ever-changing landscape of this pandemic, we are witnessing history happen right before our eyes. And it is vital that we document what is happening to each of us. We invite you to join the museum, who has been actively collecting that history through our COVID-19 History Project, and now the 12 Months in 6 Words project that we have partnered on with Illinois State University, Illinois Wesleyan University, and Heartland Community College. We invite you all to participate in these projects so they can preserve and document our varied experiences through this shared life-changing event. More information about both projects can be found on our website, mchistory.org. We hope that you will share your experiences with us. This concludes our Remembrance event. I would like to thank Not in Our Town, the Immigration Project, ISU, Wesleyan, and Hartman Community College for sponsoring this event. The white flags that you see on the lawn will be up the entire weekend if anyone would like to come see them in person. We thank you for joining us, and we hope that all of you continue to be safe and well. We are all in this together, and we can continue to do this together. Thank you.